Joining me right now on the phones from the Texas Public Policy Foundation is Chip Roy. Chip, good morning. Welcome to the show. How are you?
Morning, Chad. How are you? Thanks for having me on.
Absolutely. Appreciate you coming on today. The big topic, or one of the big topics that, the Texas Public Policy Foundation, obviously, you guys are busy, right now with the legislative session, but you're also taking a look at what the folks in D.C. are doing when it comes to health care and this GOP replacement for, Obamacare. The Texas Public Policy Foundation, correct me if I'm wrong, y'all have come out against the House leadership plan, correct?
We certainly raise our concerns that we don't think it's consistent with our conservative beliefs and beliefs that healthcare ought to be market-driven and any regulations ought to be state-based, not federal. And we don't believe that the current GOP proposal led by Speaker Ryan, adheres to those principles.
What could, if y'all were sitting in a meeting with Speaker Ryan and House leadership, which I'm sure you would love, if you were sitting in a meeting with him, how would you help craft a bill? What would it look like?
Well, having spent 2 years as Senator Cruz's chief of staff, I've been in dozens and dozens of those meetings, and I know how they go. We're having those conversations, and we're communicating information up that we think is helpful.
Good.
Look, what we think is important here is to focus on the problem. What is the underlying problem of Obamacare? And I'm sure your listeners are going to largely agree with this. Obamacare's problems are that they're built upon Medicaid expansion, regulations, and subsidies. And these things interfere with the market and the ability of the market to drive down prices. The problem is cost. Everybody's feeling it, right? We're feeling the premiums go up. We're feeling the healthcare costs go up. And that's what is underlying the problem of Obamacare. The solution to that is not to have the federal government come in with another bill, which is also based on Medicaid expansion, on subsidies, and on regulations. And that's what we have with the GOP proposal. They leave all of the regulations in place that are the things that restrict the ability of the market and competition to drive down prices. So that's the fundamental problem. Get rid of the regulations, get rid of the barriers to competition, free up the market to give us more choices, more options, more doctors, lower costs, and we can have a healthcare system that will carry us forward. But if you have a federal-based system where they're going to offer more subsidies in the form of tax credits and leave regulations in place and leave the Medicaid expansion, which is really costly, in place, then you don't have a solution that's going to transform the healthcare system. We're going to get more of the same, and in fact, it will possibly be even worse, because when you undo the individual mandate, which of course we're all offended by from a liberty standpoint, but when you undo that, you're taking away a lot of the dollars that would flow into it from healthy individuals that would end up backing out of insurance. So we think they need to get back to market-oriented approaches and focus on that.
Do you buy the argument that since it's a reconciliation bill, they have to get it through the budget process first? And you've been involved in this. Like you said, you were on your chief of staff for Senator Cruz, so you know how this works. That they have to get it through that with a 51 vote threshold, because let's be honest, 60 votes aren't there right now in the Senate to get something through. Democrats aren't going to work with this president. Do you believe that when House Speaker Ryan comes out and says, hey, the regulations that you just brought up, those are going to get rid of in bucket number 2, when Tom Price can go through and handpick the regulations and get rid of whatever, and then in bucket number 3, that somehow we'll get that 60-vote threshold, that's when you're going to have competition across state lines. Do you buy this whole plan? And if the whole plan went through, would it achieve what you're looking at?
So I'll answer. There's a few questions buried in that. First, do I buy into the overall plan, this sort of bucket approach? Well, we'll do some of it now, some of it in the future, more of it way out in the future. The answer to that's no. I mean, I have seen this play before. This is Lucy and the football. And what we're going to see is this first round are the things that do not actually address the cost and don't repeal the regulations. You leave the regulation repeal for a future date, a future bucket. Well, those won't happen. If they don't have 60 votes today, and they don't believe they can do it with 51 votes, which is what they're saying, and I'll address that in a minute, then why would they do it tomorrow? Why would they do it in 6 months? They won't. What they're trying to do is restructure Obamacare, move the chairs around the Titanic, and then say they've repealed it when they haven't. And that's a real problem, because then the GOP owns what they've done. Let's get to the 51 vote question without getting into Senate rules and procedures, which bore me, and I'm sure would cause your audience folks to have their eyes glaze over. The short answer is this: the Senate as a body can do anything it wants with 51 votes. Okay, we saw that with Senator Reid blowing up the filibuster for judges. Right, he changed the rules so that it's 51 votes only for all the judges except for the Supreme Court nominees. Well, what that means is the Senate absolutely can do it. The only question on the table is, if you go with 51 votes through any process, whether it's changing the filibuster rules or, in this case, changing what they call the reconciliation rules, which is the budget process, what then is the precedent that follows? Our position, and I think Senator Cruz's position, which he's explained several times in op-eds, as have I, is that the reconciliation process, again, not getting too in the weeds, the budget process allows for a 51-vote threshold if what is coming from the House and what is put on the floor of the Senate has a budgetary impact. Our position is there is zero question that all of the regulations and all of the parts of Obamacare that came from the original passage, the fruit of the poisonous tree, if you will, all have a budgetary impact. And if the parliamentarian looks at that, she should rule that it has a budget impact. If she doesn't, then 51 senators need to just say, yes, it does. And the impact of that will not be to massively change the way the Senate operates. It will just simply recognize that Obamacare was flawed, was passed in significant part using reconciliation by the Democrats, and that now we're saying there's absolutely a budgetary impact, and we can repeal it with 51 votes. All of that is very simple, complicated to speak to just say, yes, they can. They need to have the will to do it, and unfortunately, they often do not.
Visiting with Chip Roy from the Texas Public Policy Foundation. Let me ask you something on a practical level. I think most conservatives, I would like to say all, but I think most conservatives, the best plan would be a full repeal of Obamacare, correct?
Correct.
Get the federal government out of insurance. And really this has nothing to do with health care. This is insurance. So get government out of insurance, get them out of this area completely. Is it feasible, though, when you have a president who campaigned on saying we want to take care of everybody, no one's going to lose their insurance, when you have members of Congress that are gun-shy and worried that people are going to lose their health insurance, is it feasible to say, let's just replace Obamacare and not do anything?
Taking it step by step. The first and most important thing that you just said is full repeal. Right now, when the folks in Washington are talking about it, they're really talking about partial repeal, not the regulations. Our position, to your point, is full repeal. Right. Repeal the regulations, free up the market. So then what? We think that the main things that need to happen, and Senator Cruz agrees with us. He has a great op-ed with Congressman Meadows today in the Wall Street Journal, and he's talked about this before. There are other members in the Senate and the House that agree with us. Mike Lee, I think Rand Paul is there. We believe that the solution is you've got to equalize the tax treatment. Again, without getting into the weeds, right now the tax treatment is biased in favor of employers, but not individuals. And you need to make it to where you get to deduct your health care regardless of your employment status, so we can free the market up so you're not locked into your employer for health care. It's fine if your health care wants to provide you that benefit. That's awesome in a free market. But you shouldn't be boxed in. You ought to be able to move around the market and keep your insurance, just like we do with automobile or homeowners or other insurance policies. You know, one little side note that I think you'll appreciate, my kids are 5 and 7 years old, respectively. We watch very little TV, but we do watch a lot of sports. And the sports we watch, you know, they pick up on the advertising jingles. Mm-hmm. I can ask them Nationwide, Progressive, State Farm, Allstate, and they can tell you all the jingles, right? Bum, 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 or whatever it is.
Yeah.
If I ask them to tell them the jingles of Aetna or Blue Cross, they look at me with glassy eyes and give me crickets. And I'd ask all your listeners, do the same thing. Your kids will not know because there's no requirement or no need for those companies to advertise for your business. And therein lies the fundamental problem. If we can get the tax treatment set so that you as the individual human being who wants to have a doctor who takes care of you can have insurance and hold that policy regardless of your employment status, we can make that happen through tax treatment. And then the second point is that we need to block grant or give the Medicaid dollars to the states without string so that the states can better run our safety net program. Medicaid was designed to be a welfare program for the poor and for folks who need help with getting health care. We need to get back to that. Obamacare shoved millions of able-bodied people into the Medicaid rolls. All of this noise about Obamacare covering another 15 or 20 million people, 14 million people were shoved into Medicaid. The result of that is to make Medicaid worse for the people who need it and to build our healthcare system on the back of basically a welfare program. And that's wrong. We have 752 people who died in Illinois last year, according to reports up there, while they were waiting for care because able-bodied people had been shoved into the rolls on Medicaid, and people who were truly sick and needed help weren't getting coverage. That is horrifying in the United States of America. So the solution is to repeal Obamacare, equalize the tax treatment so you can keep your insurance, and then block grant Medicaid to the states. In Texas, we could save $5 billion if the federal government would just give us the federal dollars they currently spend without strings attached. And then we could take that money and have health savings accounts, high-risk pools, all sorts of ways to help Texans that we know there are people in our communities that we can take care of it better than the feds can.
Visiting with Chip Roy. Chip, before I let you go,
sure.
And I want to ask you, because you know Ted Cruz, well. There are a lot of people who are a little bit surprised at how Cruz is acting with this plan. I've seen headlines that he's tiptoeing around this, though he has written some editorials saying that the current plan can't work. Current plan can't pass through the House, can't pass through the Senate. What do you think? And he's had dinner with President Trump. Do you think that Cruz is kind of working behind the scenes and trying to negotiate, between the White House, between the House, between the Senate, trying to make this a more conservative bill? Do you think that's what he's up to?
So I do know Senator Cruz well, and I think if you look at today, you mentioned the op-ed, today's op-ed with Mark Meadows. Keep in mind, Mark Meadows is the chairman of the House Freedom Caucus, okay? So that's the very conservative group in the House.
Yeah.
And so Senator Cruz today teamed up with Mark Meadows to put out a plan that is diametrically opposed and different than the current House leadership plan. That's a big deal, and that's a big statement. And I think Senator Cruz and his staff are working very hard every single day trying to work around the system on the Hill to get conservative health care policy at the forefront of this debate. If you read through that op-ed, that's the plan that we need. And by his putting that out today there's a vote in the Budget Committee in the House on the GOP care bill, on this replacement bill. And next week we know that bill is trying to move to the floor. That's very purposeful. He and Mark Meadows did that intentionally to try to shape the debate, that there absolutely is a better way, and that way is market-centric, and that we shouldn't chase the fool's gold of these promises that will never be kept, like normal Washington business-as-usual solutions. So to answer your question, I think that op-ed speaks volumes about where he is and what he's doing behind the scenes.
Wonderful. Chip, as always, appreciate having you and the good folks at the Texas Public Policy Foundation on the program, and I'm sure we'll visit as the process continues.
Happy to anytime. Thanks for everything you do out there.
Thanks, Chip. Appreciate it.
Bye-bye.
All right, that's Chip Roy, Texas Public Policy Foundation. Good discussion on health care right there.